actively you have to flex. Then what will you ask? Are you feeling any sort of pain on the calf muscles or behind the knee? Okay, behind it. Can I repeat for the other leg? Yeah. Okay. If they are telling yes, what does that indicate? Positive homicide. That indicates chances है DVT start हो गया, DVT में उसका chance indicate किया है. And you also have to palpate the calf muscles for any sort of, अगर thrombin form हो गया तो वहाँ पे आपको क्या feel होगा? Lump, like a small lump or any other type of abnormality या ऊपर नीचे कुछ feel हो गया. What if the mother says no? If they said yes, positive homicide, chances of DVT. What if they said yes, no, negative homicide, but you are not going to entirely rely on the verbal response. Why? Most of the chances पे क्या होता है? DVTs are not symptomatic. मतलब pain feel होना जरूरी नहीं है. तो क्या करना है? First you ask for pain. If they said yes, okay fine. If they said no, yes or no, दोनों टाइम में क्या करना है? You have to palpate and see, and also check for. You have to palpate for pulse. देखो pulse का कैसा पता चलेगा? Pulse rate तो पता है, right? 60 to 100 average 70 होता है, but there is also a grading for pulse. ठीक है? 0 plus 1 plus 2 plus 3. मतलब 0 मतलब no pulse. Plus 1 pulse is present but it is weak. When you try to थोड़ा hard press करेगा तो वो pulse absent जैसा आपको feel होगा. Plus 2 means normal pulse. Plus 3 थोड़ा और उसका force ज़्यादा है. I'm not talking about the speed. I'm talking about the force, both the force of the pulse. ठीक है? Third means you can feel a little bit more pressure, and fourth में क्या है? थोड़ा और severe, hypertension में जैसा होता है ना? ठीक है? You have to compare it with both the legs. ठीक है? For example, I got +1 over here and I got +2 over here. That indicates यहाँ पे नॉर्मल है +2 and यहाँ पे +1 है, मीन्स वीक है, बिकॉज चांसेस है वहाँ पे थ्रोम्बिन फॉर्म हो गया पार्शियली और कंप्लीटली वो ऑब्स्ट्रक्ट होने का चांसेस. दैट्स द थिंग व्हिच यू आर गोइंग टू सी इन homicide. एंड द लास्ट वन इमोशनल स्टेटस. अभी तो हमने क्या क्या चीजों के बारे में डिस्कस किया था? breast, uterus, bowel, bladder, lobia, episiotomy, homicides, physiological aspect में ज़्यादा फोकस किया, right? How it looks, how it feels, pain है या नहीं है, contract हो गया नहीं है, contract हो गया, bladder full है या empty है, bowel movements present है या नहीं है. You can do all the checkings. You will take the input from the mother side, it will ask you questions, etc., etc. But I would say इससे भी ज़्यादा importance कहाँ पे देना है? Not like you are not giving importance, you have to give importance to the emotional status of the mother, because postpartum depression, postpartum blues, ये सब condition में जाने का chances है because of the different hormonal changes and other things happening inside the body. So how can you assess that one? Are you going to directly ask mother, how are you feeling, madam? Are you feeling okay? Are you feeling happy? Yes, you can ask. Before that, you are going to assess. देखो, what the mother is doing. Is the mother taking care of the baby? Baby is crying. Immediately क्या करेगा? Oh, breastfeeding दे दिया. ठीक है? The mother is taking care of the baby. First scenario. Second one, the baby is crying. The baby has fast motion. The baby has fast urine. The mother is क्या हो गया? Is that a problem? Is that a problem? Yes or no? First you observe. Is the mother taking care of the baby? Is the mother interested in knowing more things related to baby? ठीक है सिस्टर ये फिर ब्रेस्ट फीडिंग देना था कितना बार देना है कैन आई गिव दिस वन कैन आई गिव दैट वन ये पोजीशन सही है क्या सिस्टर अदरवाइज कंप्लीटली दे आर नॉट टेकिंग केयर ऑफ यू एंड आल्सो are they having any sort of support group photograph हमने देखा था right who is the support group available husband family members relatives if no what is the reason ठीक है फैमिली के अंदर कुछ प्रॉब्लम है दे आर नॉट टेकिंग केयर ऑफ द मदर शी विल आल्सो फील सैड एक्सेट्रा एक्सेट्रा सो हियर यू कैन डू वन थिंग यू माइट हैव लर्नड इन योर चाइल्डहुड नर्सिंग दैट इज अ टेक्निक कॉल्ड रूमिंग इन सुना है क्या है you are allowing the baby and the mother to stay together for approximately 24 hours without any unwanted disturbance from the outside. ठीक है normally क्या होता है when a baby is born uncle auntie relatives nephew everyone will come together over they are touching the baby यहाँ वहाँ पे ठीक है the mother is may not get enough time to start that initial bonding with their child so keep them separately in a room provided that they are having all the necessary things and resources with them without unwanted disturbance so क्या होगा they will start developing a bond the mother will start developing a bond with the child and the child will also start developing a bond with the mother ठीक है and you can also ask if you find any abnormalities the mother is not taking care of the baby the relatives are showing some harsh behavior on the mother okay so you can ask is there a particular problem are you facing any issues how can I help you can provide counseling you can provide any sort of therapy to manage their emotional well-being okay we have finished with postpartum assessment clear okay bubble tea what क्या है full form you might be answering how to do the assessment यहाँ पे problem आता है ठीक है you know it's breast B stands for breast you can write it in your exam how to assess ठीक है techniques first inspect then palpate then ask for feedback from the mother same for all other techniques I hope this is clear let's go to the next one so we will see few videos and few exercises which you can educate the mother to do in the postnatal period ठीक है antenatal period में एक्सरसाइज फॉलो किया था postnatal period में भी इंपॉर्टेंट है या नहीं why it will help in involution of the uterus ठीक है बॉडी में भी थोड़ा ज्यादा वेट था फ्लूइड वॉल्यूम ज्यादा था मसल वॉल्यूम ज्यादा था फैट वॉल्यूम थोड़ा ज्यादा था तो वो प्रॉपर वापस नॉर्मल सिचुएशन में लेके आने के लिए वो हेल्प करेगा ठीक है आई विल शो यू फ्यू वीडियोस रिलेटेड टू द postnatal exercise
Okay, ma'am. So now I'm going to show you the postnatal exercises. Okay. So the first and the foremost exercise that you have to do it is the breast pumping. Okay. So what you have to do, you have to start slowly, right? And slowly, you have to speed up. Okay. 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 Clear? After that, then the next exercise that we are going to do, it is about the breathing exercise. Okay. So in the breathing exercise, and then exhale. Okay. When you are exhaling, you have to exhale slowly. Okay. Okay. Let me show you again. Then the second one is the abdominal breathing exercise. Okay. So in the abdominal breathing exercise, we have to place one hand over the chest, okay, and another one over the abdomen, okay, and then yes, correct. Then you have to inhale and then exhale. Okay, you are able to feel the movements, okay. Okay. Is this clear now? Yeah. Okay. Next, I am going to show you about the head lift exercise. Okay.
Lie down. Bend your knees with your feet flat on the floor. Inhale and relax. While you exhale, lift your head and neck off the floor. Inhale as you lower your head.
Okay, is this clear? Can you repeat it one more time? Yes. The time when you just inhaling, you have to relax. Okay. And at the time of exhaling, you have to just put your hand forward. Okay? Just, yeah, you have to lift it. Okay? Is this clear now? Yeah, clear. Okay. Now I am going to show you about the knee neck rolling exercise. Okay. Okay?
Lie down. Bend your knees with your feet flat on the floor. Inhale and relax. Spread both your arms. Turn your head to one side and roll your both knees to the opposite side. Wait for 2 seconds. Repeat in the opposite direction.
Next, I am going to show you about the pelvic floor exercise. Okay? In the pelvic floor exercise, again you have to lie down. Okay?
Lie down. Bend your knees with your feet flat on the floor. Inhale and relax. Lift your pelvic part away from the floor, tightening your hips. Wait for 3 seconds. Then repeat. This exercise helps in involution of uterus.
Is this clear? Yeah, it's fine. It's clear. Okay. So now, in these exercises, when like today you are going to get discharged, right? So when you will go home, so you can do the walking exercise and you can do the deep breathing exercise and the abdominal exercise, right? Abdominal breathing exercise. So these three exercises you can perform just after going to home, right? But rest of the other exercises you have to start after the follow-up. Okay, when you will come for the follow-up with your doctor by the end of this week. After then, she will also give you some particular pamphlets or brochure for the exercises. After that only you can start. Okay. Usually after the deliveries, after some 4 to 6 weeks, we can start with the other exercises. Okay. Is this clear? Yeah, clear. Fine. And sir, you have to help her. Okay? Yeah. She have to do.
Okay, clear? Okay, we only have demonstrated few exercises. Okay, rest of the exercises का slide आपको same point में मिलेगा. So we are going to discuss about the app. Take your phone. Don't get confused. We'll be discussing about two apps. One, which our company is providing free access related to the mandatory module, and the other one, SDA, through which you will get different videos Because that is entirely free of, that is also you are getting free of access. There is no need of any payment or something like that. So first open your SimPoint app.